A neat way to think about acute and chronic injuries is that acute injuries, they develop suddenly. And chronic injuries, well, they develop over time. So that's a nice comparison for us immediately, right? We've got these sort of notions of acute and chronic. And you can use these phrases, by the way, in other contexts outside of injuries. Something that's happened suddenly, temporarily, short-term, acute. Something that's over a long period of time develops progressively is chronic. Now, where I want to start on this is I immediately want to draw your attention to fractures. Now, I'm going to, first of all, ask you whether you've broken any bones in your life, whether it was a leg or a clavicle or whatever it happens to be. Have you gone through that? And I'm pretty sure if you have, you'll be able to tell people it was pretty painful and you experienced pain in that situation. And almost certainly you required some kind of medical attention. Now, those are characteristic of a break or a fracture. Now, beyond that, what I want to do here is I just want to draw your attention to some different types of fractures, 3 of which are acute and 1 of which is a chronic condition. First of all, I want to bring your attention to what we might call a simple fracture or a simple break. And these are simply what we would call broken bones that do not break the skin. Okay, so let's just refer to them as broken bones. But it's also worth us knowing about things such as compound fractures. And a compound fracture is the opposite of this because it does break the skin. The break is so severe that the bone, literally pokes through the skin and makes a right old mess. And if you've experienced this is really, really not a pleasant experience at all. So bad luck if that's happened to you. I hope you're okay. Now, the third type, which is the only one of these, which is a chronic injury, and that chronic injury is what we'd call a stress fracture. Sometimes we call it a repetitive strain fracture. So this is when we undertake repetitive actions, and let's say running as an example, and we gradually develop something like a crack in the tibia. That would be a pretty common one. And we get this from overtraining, okay? So overtraining is going to be the cause of this in almost all cases. And just to remind you, this is the one that's chronic. The others are all acute. And the last one, I don't know. I'm not sure you're going to actually get asked about this in a question, but it might be part of an answer. I wanted to make you aware of what's called a green stick fracture. We don't talk about these very often, but a green stick fracture is where a bone kind of gets impacted on one side and it kind of develops a crack on the other side over there. That's what we mean by a green stick fracture. So we would describe it as damage or impact on one side. Damage on one side causes crack on the other. Okay, causes a crack on the other. So let's imagine you fall off your bike and you bang your lower leg. You might bang the outside of your leg, but the crack develops on the inside because it's been sort of pressurized to break, but cracks on the other. So that's what we mean by a green stick fracture. Okay, so just repeat. Very painful, require medical attention. Occasionally things like a finger or toe. Some people don't get treatment for those, but if in doubt, obviously go and get it sorted out. Now, other examples, I want to talk to you about dislocation. And again, if you've experienced this is not a pleasant experience. I've actually never had a dislocation personally, although I've had a broken ankle before, and that was pretty unpleasant. But dislocation, this happens at joints, okay? Whereas our fractures, they happen to bones, right? They're not the joining of bones. Dislocation typically happens through impact. It's an impact injury in the main. Could be a fall, for example, let's say from a horse, an equestrian. And what we need to do for this is we have a need for realignment. So effectively, the bones need to be put back into place. Now, can I stress that however enthusiastic someone is in your rugby team, your tennis club, whatever, to put your dislocated shoulder back in, they must not do it. A finger even, that needs a medical specialist who's going to perform the action for you, usually with some kind of gas and air or other kind of pain relief in that situation. So do not engage in that kind of thing. I've seen that done numerous times on the sides of sports fields, and it is not a good idea. Now, finally, I should stress that's an acute injury as well, of course. Now, finally, with our acute injuries, remember that stress fracture was chronic, of course. I want to talk about soft tissue injuries, and I want to address 2 types for you. Type 1 of soft tissue injuries here, I want to talk about the idea of a strain. And think about strains and what they might mean to you. Well, in this context, we are talking about a type of muscle damage. So let's say you go for a sprint at the first 5 minutes of a football match on a really cold day and you haven't warmed up properly, you might experience some kind of muscle damage. And they tend to be related to the idea of pulls and tears, okay? Pulls and tears. And then secondly, we're interested in the idea of a sprain. Now, of course, strains and sprains sound extremely similar, but a sprain is specifically ligament damage, okay? So make sure you can differentiate between these two types of soft tissue injuries. There are others, of course. You could experience, for example, a tendon damage. We actually include that under strains. But under sprain, we are talking about this being a twisting injury. Whereas, our strains are going to be more like because we've done some kind of explosive plyometric type activity, typically. Now, finally, I want to sort of finish this off with with a bunch of chronic conditions. Ugh. So, if you've ever experienced any of these, bad luck. The first one I want to introduce you to is that which is called Achilles tendonitis, and let me tell you that I've had this in my time, and it blinking well hurts. I've had it to such a degree that sometimes I literally can't get out of bed with this particular condition. It's not been for a long time, but it's really, really unpleasant. And this is where you get your Achilles tendon, which of course is the tendon that connects your gastrocnemius down to your calcaneus, your heel bone. Your Achilles tendons, it's their sheath that gets damaged. Okay, so to be clear on this, we've got a muscle the gastrocnemius that leads down to the tendon, and both things are surrounded by a sheath, and that sheath becomes damaged, and that's called Achilles tendonitis. Okay, again, it tends to happen through repetitive action, too much weight-bearing activity, too much running-based activity. We also just want to repeat that point about stress fracture. We mentioned it up above. Lots of examples would be like a tibia fracture, and again, it's exactly the same point. So I'm just going to sort of literally say see above or see previously for that one. And thirdly, I want to talk to you about tennis elbow and what a name of a condition this actually is. It's a form of tendonitis. Okay, so it's tennis elbow, and let me write that in for you. It's a form of tendonitis. So a bit like our Achilles tendonitis. And what happens here is you get pain on the outside of the elbow. Okay, outside, not the inside of the elbow. When I say the outside, I mean the lateral side. Not like it's on the outside of your body, but the outside edge, sort of, what we call lateral, not the medial side. And we tend to acquire this condition because of poor technique. Someone who's not hitting their tennis serves with the correct technique, for example, might experience this, and it's from a repetitive action. Hence, we call it tennis elbow, because people who play tennis and do so with slightly questionable technique, repetitive action, do so with slightly questionable technique, might be more inclined to experience this. But of course, you can get it from other conditions and from other activities. Of course, you can. Thank you.